Hello, I'm Dr. Lois Kilowich. I'm a vascular surgeon at the University of Texas Medical Branch, and I'm the medical director of the UTMB Comprehensive Vein Clinic. I'm here to talk to you today about varicose veins. Varicose veins are an extremely common medical problem. Estimates are that up to 75% of women will experience some problem with varicose veins in their lifetimes. And even about 50% of men will have a similar problem. Varicose veins are shown on this slide and range from very large bulging veins like the one shown here that actually protrude from the skin, and the spider veins that we think of more in terms of a cosmetic problem. The large veins, such as the one shown here, cause problems associated with pain and swelling in the legs and some other things that I'll talk to you a little more about. The panels here on the right of the slide show spider veins. Spider veins are enlarged veins within the skin and tend to be mostly a cosmetic problem. The large varicose veins that protrude from the legs cause a variety of symptoms such as aching pain, particularly when someone has been on their feet all day, as well as swelling. In severe cases, they can also cause clotting, which can be dangerous, and bleeding and infection. Risk factors for varicose veins, as I said previously, they're much more common in women. We think this may be related to the hormonal milieu that women experience, and some women will often complain about the fact that the veins get worse during their periods. Other risk factors associated with varicose veins include a family history, a history of blood clots in the veins deep inside the legs, and pregnancy. Varicose veins are caused by problems with valves inside the veins of the legs. Just to explain a little bit about what veins do, veins are the blood vessels in the body that return the blood from the legs and the feet back to the heart. So the heart puts oxygen into blood, and arteries carry that blood to all of the organs within your body, including the legs. Once the oxygen is extracted from the blood, the veins return the deoxygenated blood to the heart so that more can be put in. Veins in the legs normally have valves in them that only allow the blood to travel from the feet back up to the heart. That's illustrated in the panel on the left of the slide. When you take a step, the muscle in your calf will contract and push the blood up toward your heart. And when the muscle relaxes, the valves will shut, and that prevents the blood from flowing back down into the legs. In persons who have varicose veins, often they're born with valves that either don't function properly or aren't even present. When the calf muscle contracts, the blood is pushed up toward the heart, but when the muscle relaxes, the blood simply flows back down in pools in the legs. This causes the vein walls to enlarge and become very tortuous, and the result is those large varicose veins that protrude from the skin. Sometimes, for reasons that we don't fully understand, instead of developing large varicose veins, that extra blood volume and pressure will be pushed out into the veins within the skin, and this results in enlarged spider veins. For many years, the treatment of choice, or the standard treatment for varicose veins, was compression stockings, sometimes referred to as support stockings. What these do is they simply compress the veins and prevent the blood from pooling. They were first developed back in the late 1950s, and at that time they were really only available in very ugly colors and very heavy weights. Nowadays, there are a variety of styles and colors and weights available. They're made for men. They look like regular men's dress stockings. They're also made for women. You can buy them as pantyhose if that's your preference. They are effective in terms of reducing swelling, and this can reduce pain. However, they are only effective when they're worn, and they're not really comfortable to either put on or to wear, particularly in a hot climate like we have here in Texas. So compliance with them can be quite a problem. In the old days, the primary treatment for large varicose veins was what's called a vein stripping. And this was a fairly invasive procedure where a large catheter was placed through the vein in the thigh, and it was essentially inverted and pulled out. At the time this was done routinely, the standard hospital stay for a patient was 3 to 5 days, sometimes as long as a week, and the total recovery time was several months. We don't do this procedure routinely anymore. We've now been able to replace it with a much less invasive procedure that I'm going to tell you a little more about, which is called an ablation. In addition, large clusters of varicose veins in the calf are removed by a procedure called phlebectomy, or sometimes they can be injected, called sclerotherapy, which causes them to scar down. Spider veins are generally treated with an injection as well of a different type of material. We don't recommend laser treatment for spider veins because it's been found to be relatively ineffective and can also be quite painful. This slide demonstrates a phlebectomy procedure. The patient has a large cluster of varicose veins that are bulging from the skin on the medial aspect of the knee. Phlebectomy means to take out veins, and what we do is, using a light source to identify the veins, we make a series of 5 or 6 tiny little incisions, maybe 2 or 3 millimeters in diameter, so 1/4 of an inch or less, and we remove the veins in that fashion. This is a procedure which can be done either in the clinic or in the operating room. If it's done, or regardless of where it's done, the patient can go home the same day. Patients are usually off work 2 or 3 days, and the total recovery time to complete results, such as shown in the panel on your right, is about a month. That large saphenous vein in the thigh that often has malfunctioning valves is treated with a procedure called an ablation. We first diagnose the problem using an ultrasound, and you can see a picture of the vascular technologist with the ultrasound probe on the patient's thigh, identifying the vein and the fact that the valves are not working properly. Once this is done, we do a procedure where we insert a small catheter into the vein around the level of the knee. It's advanced up to the groin, where the saphenous vein joins the deeper veins in the leg, and then the catheter is heated up and the vein is injured and closed. This is also a procedure which can be done either in the clinic or in the operating room. In either case, the patient goes home the same day, is usually off of work over a weekend possibly, and the total recovery time is about a month. I've heard this procedure described as the lunchtime procedure. Sometimes patients can come in over their lunch hour, get the procedure done, and go back to work in the afternoon. This just shows an example of a procedure where we performed an ablation on the saphenous vein in the thigh and a phlebectomy on the veins in the calf, and after about a month, the result is shown in the panel on the right of the screen. This slide shows how we treat spider veins. Spider veins in general are treated with what's called sclerotherapy, which again is an injection of a material that causes the veins to scar down. In the panel on your far left, you can see a cluster of spider veins in a patient's thigh. We would inject those probably in 2 different sessions over a month or 2-month period, and the result that we have after 2 or 3 months is shown in the bottom panel on the right. There's another example on the right-hand side of the slide, and again, group of spider veins in the patient's thigh. The injections are done over a 2-month period, and the result after 2 to 3 months is shown in the panel on the far right. Very often patients ask me whether insurance companies will pay for these types of procedures in the leg. In general, the large varicosities that are bulging from the leg and the poorly functioning saphenous vein with the bad valves, those procedures are covered by insurance. Spider vein injections, primarily done for cosmesis, are generally not covered by insurance. This is our very friendly group at the UTMB Specialty Care Center at Victory Lakes. We're there every week, and we'd love to see you come in and have us evaluate and treat your varicose veins. Thank you very much.